Hello everybody, and welcome to the Tuesday edition of Video Clips. And as usual, I've got a couple announcements, only a couple today. One is that the Why and How to Withdraw from Psychiatric Drug course starts next week. Very excited about this. First time anything like this has ever been offered through a school like ours. And I've been working hard on the curriculum and the slides, and I have a combination of fascination with the material and getting my blood pressure higher from looking at the material. I mean, it's just horrific what's been going on for all these years with 25% of the country drugged, and I feel very, very strongly we have to do something about it, which means we have to educate healthcare practitioners, and we've got to help people understand how to help themselves. So if you want information on it, starts next week, October 3rd. It will be here before you know it. Send me an email at pampopper@msn.com. And then we are on the Countdown for Conference, which is November 10th through 12th. You will spend the weekend with Peter Goethe, the co-founder of Cochrane Denmark, with Peter Bregan, the psychiatrist from Ithaca, New York, Dee Anthony, one of the stars of Food Choices, who dissolved a 2-pound tumor. I mean, think about that for a minute. That was definitely terminal by adopting a plant-based diet. Jeannie Stolzer, child psychologist, who will talk about why we shouldn't drug children with ADHD. Janice Stanger is going to talk about diet and aging. I don't know about you, but I'm 60 and I'm fighting like hell to not look like I'm 60 and to go backwards instead of forwards. So if you want to know how to do that using diet, Dr. Stanger. And then Eileen Kopsaptis, how to resolve pain without drugs and surgery. Last but not least, our favorite, one of our favorite speakers, Dr. Richard Ablin, the cancer researcher who discovered prostate-specific antigen. He is always fascinating, and I might add a little funny to listen to. If he could be a comedian if he got out of the cancer research business. So who would not want to spend 3 days learning from this type of person, this lineup that we have? It includes meals. Don't miss it. Again, pampopper@msn.com. You can also go to our website at wellnessfarmhealth.com and learn more too. All right, so since next week starts Why and How to Withdraw from Psychiatric Drugs, I have 2 articles I want to talk about that cover just that. According to a new analysis, drugs for treatment of depression, anxiety, obsessive-compulsive disorders, and PTSD are almost worthless for both children and adults. The review included 36 trials with over 6,700 subjects and looked at the use of selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs. Both were shown to be more beneficial than placebo in some cases, but barely, just barely. Patients with depression responded better to placebo than to the drug, and patients with anxiety responded a tiny amount better to the drugs than placebo. Side effects leading to discontinuation were significantly more common in those taking the drugs than placebo. That's one of the reasons why trials are so difficult to do with psych drugs. Pretty much everybody knows who's taking the drug. The authors concluded that the benefit of the drugs was, quote, small and disorder specific, the response to placebo is large, and severe events are significantly more common with SSRIs and SNRIs than placebo. Those were quotes. Now, according to Dennis Butler, PhD, professor of behavioral science at the Medical College of Wisconsin, the high response rate to placebo may be due to the fact that children and adolescents respond well when they're just given some attention. He says that listening, support, and reasonable advice may be what they need. Now, Dr. Butler is quick to add that the drugs are effective and can be highly beneficial, but he states that doctors should fully inform adolescents and their parents about the risk of side effects when taking them. More and more people are getting on board with this informed medical decision-making idea that we promote here. Of course, the problem is this is never done. I have never in 21 years had somebody come in here on the drugs and tell me, well, you know, I did get a chance to look at all the research and I knew this could happen. Not a single person in 21 years was ever given a full informed discussion about these drugs before starting to take them. You know, Dr. Butler may be onto something, though, with his previous comments. Perhaps what all people, including children, need when they're in a state of distress is for others to demonstrate in meaningful ways that they care. Maybe this is the secret to helping people, and of course it is. But the reason it doesn't catch on is it's easier to drug people than it is to help them resolve the situations in their messy lives. And I might add that there's $1 billion, multi-billion-dollar a year industry that profits from drugging people. You really don't get paid quite as well for helping people resolve their issues. So on to the next story, related somewhat. A well-known side effect of antidepressant drugs is a condition called akathisia. It's a state of acute agitation that is so uncomfortable that it drives some patients to commit suicide. In fact, a researcher for Pfizer wrote that for some patients, death is a welcome result. Now, isn't that a drug you want to take, right? A jury recently awarded the family of Stuart Dolan, a Chicago attorney, $3 million after he committed suicide within a few days of starting to take Paxil for his depression. The lawsuit was won on the basis of the failure of the drug company, GlaxoSmithKline, to properly inform Dolan of the risks associated with taking the drug. This lawsuit is worth some attention because so many times lawsuits against drug companies that make psychiatric drugs are dismissed or settled out of court. And the Dolan lawsuit reveals one of the reasons why the drug companies are often so anxious to settle if they possibly can. The court proceedings made public data showing that significantly higher risk of suicide has been a known risk of antidepressants since they were the subject of the very first clinical trials. Paxil was first approved for sale in the United States in 1999. In 2006, in what can only be described as a very rare instance of the FDA actually doing its job, the agency forced Glaxo to reanalyze the data from its early clinical trials, and the new analysis showed that the risk of the incidence of suicidal ideation and behavior was 6.7 times higher in patients taking Paxil versus those taking placebo. Now, this is true not only of Paxil, but all antidepressants, and they now all carry a warning label concerning suicide risk. The labels also require warnings concerning symptoms like anxiety, agitation, panic attacks, mania, and akathisia, the condition that I talked about earlier. Now, this affects a large number of people. According to data from the Centers for Disease Control, about 325 million prescriptions for antidepressants were filled in the United States in 1 year, and 1 in 7 Americans aged 40 or older has taken an antidepressant, with 1 in 5 middle-aged women having taken them. So this affects a huge percentage of our population. The risk of akathisia is a side effect that affects a large percentage of those who take antidepressants, with one review of 100 studies showing that as many as 65% of patients may experience this while taking SSRIs. 65%. According to psychiatrist Dr. Peter Breggin, our business partner, who has written many books on the topic and testified as an expert witness in lawsuits against the makers of psychiatric drugs, the drug companies have always known about this risk and covered it up. Dr. Breggin was the lead expert in lawsuits against Eli Lilly many years ago concerning Prozac. During his preparation for trial, he was given access to the company's records. Lilly had claimed that the drug had been tested on 10,000 people, but the number of patients who actually finished the trials was under 200, most of those people having been placed on benzos in order to deal with the side effects like severe agitation. Now, we could argue that the drug probably should never have been approved at all, but based on its lack of efficacy and side effects, but the actual approval should have been for an antidepressant benzodiazepine combination, not an SSRI by itself. Well, there's almost no hope that the toothless FDA will remove these drugs from the marketplace in spite of the fact that outright scientific fraud and deception was used to get them approved. I won't go into all of that here, but you can read plenty about this in the Health Briefs online library articles. The only way to address the problem is to warn people about taking them, as I'm doing here, to win financial judgments against the drug companies, because that's the only thing that they really understand or care about, and maybe to get enough damages that they won't be able to market their products in the United States, they won't be able to afford it, and to help those who are taking the drugs to get control of their health and gradually withdraw from the drugs. Now, the drug makers were able to extract an agreement from the federal government to hold them harmless for the damages done by vaccines, but I think it's unlikely that, at least I hope it's unlikely, that the government would do something like that with antidepressants. But in any case, the best thing of all is when you're confronted with the prospect of taking these drugs, just learn to say no. They have absolutely no benefit, and side effects that go on for pages and pages, and most of them are really quite severe and serious. All right, so if you want to know more about this, take our course, Why and How to Withdraw from Psychiatric Drugs, starts next week. That's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you on Thursday with more news.